This podcast is made possible by you, the supporters of WPLN and WNXP, Nashville Public Radio.
Hey, it's Tony Gonzalez, news director in WPLN's local newsroom, and you're listening to a special year-end edition of the Nash Villager podcast from Nashville Public Radio. It's special because you're about to learn something, a few things really, and you're going to do it in an interesting way. We're going to revisit 3 examples of explanatory journalism that unpack important news developments here in Middle Tennessee. It's the kind of work in which our journalists are very explicitly trying to serve you by putting in the research and interviewing time that you might not have, and then distilling what they've learned into concise stories. And here's one more cool trick about this. This snapshot of 3 high-quality stories, they all came together within a 1-week span back in September. It's a testament to the day-in, day-out work of our reporters. I want to start by taking you to an old primary forest. It's a bit west of Chattanooga. That's where there's concern that clear cutting for logging will have an impact through the State Department of Agriculture's annual allotment of logging rights. WPLN's Caroline Eggers reports on the risk of damaging one unique site in the process, a scientific research area with data going back 50 years.
In the 1970s, the Tennessee Valley Authority set up plots in the Franklin State Forest to study its ecology as part of research into acid rain from coal burning. In the 90s, TVA handed the data to researchers at Swanee, who have since studied everything from the diversity of species to the underlying network of fungi. John Evans, a biology professor at the university, has worked at the site for 30 years. He says it's rare because of how long it's been studied and the level of recorded detail.
The longer the data has been collected over time, the more valuable it becomes, because things like forests, they change very slowly. The lives of trees play out over literally centuries.
The site is on the Cumberland Plateau, where the soil is thin. Because of this, it wasn't cleared for farming like many other forests, meaning, Evans says, it's actually old growth.
And that's what makes this site so valuable, right? So we need in our landscape control sites. We need places that are sort of the canary in the coal mine, if you will, the finger on the pulse of this planet.
But this site could soon be on the chopping block. The state is forming a plan for Franklin State Forest to determine where logging can occur. And officials say it could happen in this 90-acre scientific research area. The state recently denied a request from Swanee and Tennessee State University to protect it, saying it did not provide benefit to the Department of Agriculture. Davis Munger, the co-director of the environmental nonprofit Tennessee Heartwood, says that
this agency does not value science.
But he says the agency should reconsider, for many reasons. But in terms of the greatest public value, the science happening at this site could help the state better save Tennessee's forest. Caroline Eggers, WPLN News.
You can hear how deeply the stakeholders care about that site, and it's no small thing for a journalist to clearly navigate through a topic like logging rights. Let's stay outdoors, in a way, for this next story. It came out just a few days after Caroline's. This story sheds light on a place known as Old Tent City. It's a 40-year-old encampment near a downtown interstate bridge, and it's home to over 100 unhoused Nashvillians. The Metro government was saying at the time that the largest structures built on the site were unsafe and needed to be demolished. WPLN's Char Daston got an insider's perspective from an Old Tent City resident.
Kenneth Ross is a writer who's lived in Old Tent City for about a year. He says some of the dwellings the city plans to demolish took a lot of time and talent to build.
Everything that made those houses came from the trash. A lot of these guys, someone can't read, much less they can't read a tape measure even. They're using a piece of yarn to measure things.
One building is 2 stories with a garage.
That particular house has a potbelly stove in. His potbelly stove was up to code. Proper space and everything.
Ross acknowledges there are some problems with Old Tent City, like hazardous amounts of garbage. But he wants to work with Nashville to imagine a brighter future for the encampment. For example, the city plans to use the site for a new park, so...
Why not add to your park a camping zone? Nobody has to go anywhere. It'd bring in revenue. The Parks Department would still be in charge of it and therefore could monitor it. They could have showers. They could have amenities for the kayakers that come up and down the river.
Ross and other residents say they want 90 days to plan before any demolition occurs. It's unclear whether the city will honor that request. Char Daston, WPLN News.
After some time, demolition did move forward at that site. I appreciated how the story painted a picture of these housing structures, which are in many ways extremely impressive. You can see a photo by searching for Old Tent City on our website. For our final explanatory story, we're going to what can sometimes strike fear into an editor, a story about Medicaid and subsidized insurance. This can be very deep water. In this case, health reporter Catherine Sweeney takes up a conversation with our editor and host LaTonya Turner. At issue was how TennCare, which is Tennessee's version of Medicaid, canceled coverage for dozens of families before the pandemic. A federal court ruled that they'd been wronged, and our journalists pick up with the evolving conversation around Medicaid.
So let's start with this lawsuit. Who filed it and what did they say?
The nonprofit Tennessee Justice Center filed the lawsuit back in 2019, and they filed it on behalf of dozens of families who had at least one member of the family lose their health insurance through TennCare. So the lawsuit blamed several problems. A big one was computer issues. So there's this program that automatically checks if somebody can re-up their coverage for the next year. It was flawed. It didn't take into account people's disability status or other things that would have made them qualify, and it rejected them. Tennessee's not alone in that. On Thursday, Fortune magazine and KFF Health News published this big investigation, and it found that around 25 states use a similar program to ours. And they all had these issues. It's designed by the consulting firm Deloitte. That company has made $6 billion on these programs. The investigation says about $823 million of that came from Tennessee.
Why was computer automation relied on so heavily by TennCare in the first place?
Medicaid is just this really complicated program. The cutoff for how much money you can make is different for different people. So, for example, a new mom is going to have harder requirements to meet than somebody who's still pregnant. People who have disabilities have different income requirements than people who don't. It is tough, and a lot of states want to make that easier for people, so they create programs like this. But the programs, they can be faulty.
Let's talk some about the people who were impacted by this. Thousands of people lost health insurance through TennCare. What do you know about how that impacted some of them?
Some of them, it was kind of a technicality, right? They realize they don't have their health insurance. They go through this red tape-filled, difficult time to get it back. That, unfortunately, wasn't the case for everyone. There was one example of a woman who needed surgery, but she didn't have health insurance, even though she was supposed to. So she had to put it off. And then by the time she did have her health insurance back, she was pregnant, and she couldn't get the surgery while pregnant. But the condition she needed treated made her have these severe complications all the way through her pregnancy, and she shouldn't have had them.
That's terrible. So what did the court have to say now that it's gone before a judge?
The court said TennCare was breaking the law. It said that computer program was flawed, and TennCare knew it was flawed, but, quote, dragged its feet on fixing the problem. And it also said the process was overly difficult for everyone, but also disabled people. And that violates the Americans with Disabilities Act. They said the two sides have to go together, sit down, and go through mediation.
Okay. The lawsuit was filed in 2019. Why are we just getting this decision?
Medicaid was really different during the pandemic. Anybody who got on Medicaid or was in it during the pandemic could just stay on it, even if they started making too much money or if they, for some other reason lost their eligibility, they got to stay. So this whole lawsuit is about people trying to re-up their health insurance. Nobody was having their health insurance taken during the pandemic. So they said, let's wait that one out.
That's not still happening, is it?
No. When the public health emergency ended, the federal government said, okay, everybody, you have to start doing these eligibility checks again.
Well, has anything else changed since the pandemic?
the political conversation around it has really shifted. The Kaiser Family Foundation released a poll about Medicaid programs, and basically there are two ways people look at that program politically. One, people see it as a health insurance program to help the most vulnerable people, or they see it as a welfare program. Most Democrats see it as number one, and most independents see it as number one. And it used to be that most Republicans saw it as a welfare program, but in that poll, Republicans were about 50-50. So when I was covering Medicaid in Oklahoma, lawmakers there said, it needs to be difficult to re-up your Medicaid enrollment so fewer people use it. You don't really hear stuff like that in state capitals the way you used to. The conversation around Medicaid expansion has changed too. So that's just a policy where basically more able-bodied adults are qualifying for Medicaid. So 40 states have done that. Tennessee is one of 10 that hasn't. And most of the states that have not done that, they're in the South. But even that is shifting. So North Carolina expanded Medicaid late last year. Really high-ranking, lawmakers are saying in Alabama and Georgia and Mississippi, it's not this absolutely not stance that they've had for more than a decade.
Has anything else influenced the turnaround in these attitudes?
The rural hospital crisis, that has been especially pronounced in Tennessee. So a lot of more conservative lawmakers are seeing the rural hospitals in my district are closing, and part of that is a lack of Medicaid expansion. There are too many people who don't have health insurance.
That's WPLN's health reporter Catherine Sweeney discussing the recent federal lawsuit against TennCare.
And there you have it, the power of explanatory local journalism from reporters who know their stuff. We're highlighting this work at the end of the year because we're proud of it and because we thought you'd appreciate being pointed to high-quality journalism. We appreciate you listening. Tomorrow we'll be back in your feed with one of our station's all-time favorite stories, which is not an exaggeration. I hope you'll tune in and tell a friend.